kidneys are mainly associated with filtering blood and helping to get rid of toxic substances, making them the most important detoxifying organ after the liver. However, it is important to note that they actually perform many more important functions. For example, they regulate blood pressure, take part in the formation of red blood cells, are responsible for the activation of vitamin D, maintain the appropriate concentration of elements in the blood, and also affect the acid-base balance by regulating the pH of the blood, thus preventing acidification of the body. Given the numerous tasks that kidneys perform, their damaged or impaired function can have serious health consequences. Therefore, in this video, I will tell you what symptoms may indicate that something is wrong with the kidneys. I think many of you associate kidney problems, particularly kidney failure, mainly with swelling of the legs, feet and ankles. Indeed, this is one of the most common symptoms that accompanies impaired kidney function. Swelling is caused by the accumulation of salt and water in the body, as weakened kidneys are unable to remove the excess. It is worth noting here that swelling caused by kidney failure is painless. Damage to the kidneys, specifically the glomeruli, can lead to a condition known as nephrotic syndrome, wherein too much protein is lost in the urine. When the kidneys are not functioning properly, instead of retaining protein in the body, they allow it to pass through the blood into the urine, which can also cause swelling. I will point out, however, that in addition to swelling of the lower limbs, swelling of the face around the eyes may also occur. The swelling of the lower legs is particularly pronounced in the evening, while the swelling of the face is mainly in the morning. It is also worth noting that at the first stage of kidney problems, these swellings may be transient, meaning they may appear and then disappear. As an interesting fact, I will also say that these swellings can be so severe that our body weight can increase by several kilograms in a very short time. As I mentioned, kidneys are involved in the production of red blood cells, also known as erythrocytes. When their function is impaired, fewer of these blood components are produced, which can lead to anemia. In short, fewer red blood cells mean less oxygen is delivered to the cells of our body, and if cells lack oxygen, they produce less energy. This results in a chronic feeling of fatigue. I must emphasize that the fatigue associated with anemia is quite different from the typical fatigue of everyday life. People with anemia experience complete exhaustion, which makes it difficult or even impossible to perform basic tasks. At the same time, it should be noted that this fatigue does not go away after rest, including sleep. In the course of kidney diseases, including chronic kidney disease, we often encounter polyuria, which is excessive water excretion by the kidneys. We usually refer to polyuria when we excrete more than 2.5 liters of urine per day. At the same time, patients with chronic renal failure often also experience nocturia. Nocturia is defined as frequent urination at night. According to literature data, this frequent urination during the night can affect up to 1/3 of people with this disease. At this point, I must also say that in the course of acute kidney damage or a very advanced stage of renal failure, we may have the opposite situation. I'm talking about excreting much smaller amounts of urine, which we call oliguria, and this means excreting urine in an amount of less than half a liter per day. The accumulation of toxic substances in our bodies due to their limited removal via urine causes some patients suffering from kidney diseases to experience a metallic taste in their mouths. At the same time, due to impaired excretion of metabolic products in people with kidney failure, we can also observe an unpleasant, acidic smell from their mouths caused by the presence of ammonia. Talking about the symptoms of poorly functioning kidneys, it is also worth mentioning certain skin changes. As I just said, inefficient kidneys are not able to effectively remove toxins and metabolic products from our body, resulting in these compounds accumulating in our body. This can cause changes in the appearance of the skin. In addition, in the course of renal failure, damage to the sweat and sebaceous glands may also occur, leading to the skin becoming dry, and itching may accompany it. At the beginning of this material, I also mentioned that the kidneys are involved in the production of red blood cells. What is important is that red blood cells give the skin a lively, natural color. However, when there is a disruption in kidney function, then fewer red blood cells are produced, resulting in the skin becoming paler. In addition, in some patients with kidney diseases, the skin may also take a yellowish or earthy brown hue. When it comes to skin changes, I should also mention the so-called uremic frost. In some cases, patients with very advanced kidney failure may develop white spots on their skin. These are crystals of urea that precipitate on the skin. Nevertheless, I must emphasize that this symptom is very rare. Occasionally, patients with chronic kidney disease may experience xerostomia, which is the sensation of dryness in the mouth. Staying on the topic of beauty, I will also mention that certain changes in the appearance of nails can also be a sign of improper kidney function. Specifically, in people with chronic kidney failure, we sometimes observe so-called Lindsay nails, also known as half-and-half nails. To simplify, one half of the nail plate, the one closest to the skin, becomes white, while the other distal half, the one farther away from the skin, is pink or red. Here I will add that these two differently colored halves are clearly separated from one another. Additionally, I will add that the mentioned discolorations do not disappear under pressure and can affect one or all of the fingernails or toenails. It is also worth remembering what I said in one of the first points, namely that poorly functioning kidneys can be the cause of anemia. Also, one of the symptoms of anemia is called koilonychia, which means that the nails take on a characteristic spoon shape because the surface of the nail plate becomes concave and its edges appear to be turned up. According to the literature, changes in the appearance of nails affect up to 75% of patients undergoing hemodialysis. As for the aforementioned Lindsay nails, they are visible in about 20 to 50% of patients with chronic kidney disease. People with kidney failure are also affected by a condition called renal osteotystrophy, also known as renal rickets. I expect that this term is quite unfamiliar to many people, so I will explain what it is. As I mentioned before, the kidneys are responsible for activating vitamin D. In cases of kidney failure, there is a deficiency of the active form of vitamin D. This in turn leads to specific metabolic changes. Ultimately, patients with kidney failure experience changes in bone structure which cause pain in the bones and joints, as well as tendon rupture. Furthermore, these people are more prone to bone fractures and the development of osteoporosis. At the beginning of the video, I said that improper functioning of the renal glomeruli causes too much protein to be removed from the urine, which we medically refer to as proteinuria. It is important to know that a sign of protein loss in the urine due to impaired kidney function may be foaming of the urine. I must emphasize that the foam appears on the entire surface on the urine, not just the outer part. The foaming is very intense. However, I must point out that proteinuria and foaming of the urine may also occur in other situations, such as after intense physical exertion, due to a strong stress reaction, during an infection, or this condition may also accompany other diseases, such as diabetes and hypertension. Sometimes, a sign that something is wrong with the kidneys is red discoloration of the urine caused by the presence of blood. This is the case with such health problems as bacterial kidney infections or glomerulonephritis. Blood in the urine can also be caused by physical damage to the kidneys, such as a blow in a car accident or from playing a sport. However, this is not a highly characteristic symptom. I mean that blood in the urine can also be caused by a urinary tract infection, or the urine can take on a red color after consuming certain products, including beets. Both practice and research indicate that patients with chronic kidney disease often suffer from malnutrition and loss of appetite. Experts believe that this effect may be caused by disturbances in the secretion of hormones that regulate hunger. Specifically, people with chronic kidney disease have a decrease in the concentration of ghrelin, the hormone responsible for the feeling of hunger. At the same time, these patients have an increase in the level of leptin, which is the hormone that provides the feeling of satiety. As I mentioned at the beginning, the kidneys are responsible for regulating blood pressure. Therefore, one can expect that if they are not functioning properly, there will be a problem with maintaining normal pressure. And in practice, this is indeed the case. People with kidney failure often struggle with high blood pressure or even hypertension. This is due to the two basic mechanisms. Firstly, an excess of salt and water in the body, which I have already mentioned, in the context of swelling, leads to an increase in blood pressure. And secondly, the malfunctioning kidneys produce large amounts of a hormone called renin, which constricts or narrows the blood vessels, thus further increasing the blood pressure. Patients struggling with kidney failure often report sleep problems, including insomnia. Of course, this is a non-specific symptom, but it should not be underestimated. There are several different mechanisms underlying this condition. For example, experts point out that people with chronic kidney disease have an increased level of orexin, a substance involved in the regulation of the circadian rhythm, which, in a simplified way, turns on the sleep and wakefulness mode. Additionally, it should be noted that many other ailments associated with kidney problems can lead to sleep problems such as skin itching, bone and joint pain, nocturnal urination or anemia, and the fatigue associated with it. Some women may be surprised to learn that kidney failure can also be a cause of menstrual disorders. Specifically, women with chronic kidney disease may experience irregular or absent periods. Complete absence of menstruation is usually observed in an advanced stages of the disease. It is also worth noting that women with kidney problems may experience anovulatory cycles, making pregnancy impossible. I will briefly explain how to examine your kidneys. I don't want to provide a full list of all possible tests. In my opinion, it is best to do the diagnosis gradually, that is, to start with basic tests. If the results are concerning, then it is best to do more advanced and usually more expensive tests. However, if everything is alright, there is usually no need to go for a wider diagnosis. The most basic test to start with is a general urine test. For example, it measures the presence of protein. A high level of protein in the urine, also known as proteinuria, as I mentioned earlier, may indicate glomerular or intestinal nephritis, drug-induced damage to this organ, or hypertension nephropathy, that is, kidney damage caused by untreated hypertension. In addition, such tests can detect the presence of blood in the urine, which can also indicate kidney diseases. In addition to the general urine test, it is worth measuring the creatinine and albumin levels in the urine. These two parameters are used to calculate the so-called ACR index, which is a more sensitive method for assessing the amount of protein, specifically albumin, excreted in the urine. For a correct result, we consider a value below 30 mg per 1 gram of creatinine. Experts say this test is especially useful for diagnosing diabetic nephropathy, meaning kidney damage caused by uncontrolled diabetes, as well as for detecting the early stages of chronic kidney disease. It is also worth measuring the creatinine concentration in the blood. Knowing this value, as well as gender and age, you can calculate the so-called glomerular filtration rate, GFR. Here I will add that this is one of the most basic parameters used to assess kidney function. A reduced value of it indicates impaired kidney function and renal failure. Additionally, the blood concentration of urea, uric acid, potassium, sodium, and phosphorus can be measured. I hope that this material has provided you with some new information and a different perspective on what kidney diseases may manifest as. Unfortunately, the issue is that the first symptoms of impaired kidney function often do not appear in the early stages, but rather in the later stages of the disease. That is why it is so important to be aware of your body and not ignore any concerning symptoms or signs that have recently appeared but were not previously present. Of course, it is also a good idea to periodically check the stage of your kidneys by doing basic tests, which I mentioned today, at least once a year or even once every 2 years. I also encourage you to watch another movie on my channel, this time about diabetes, which can also affect the kidneys. To watch it, just click on the thumbnail that appears on the screen. And that's it for today. Thank you for your attention and see you next time.